The calm before the storm as we're bracing for a wintry blast that appears to be gaining steam. That in just a moment. But first, no rest for the weary as hospitals deal with near capacity conditions due to the current COVID surge. Good evening. Thanks for joining us. I'm Dustin Lukey. With the Omicron COVID-19 variant now in Wisconsin, medical experts are concerned of how it might add to the Delta variant surge. News 19's Joe Minnie examines whether hospital ICUs will be able to keep up.
Statewide, rising cases of the coronavirus is creating a burden on hospital ICUs.
As of December 7th, there are 1,630 Wisconsinites hospitalized with COVID-19. 418 of these patients are in the intensive care unit.
Our census waxes and wanes hour by hour, day by day. They have been running in the 80 to 100% capacity, and we are, as quickly as somebody is leaving the ICU, we're bringing more patients into the ICU. It's a constant rotation of patients right now.
Only 37 of the state's 1,331 ICU beds were available as of yesterday.
Mayo Clinic Health System is experiencing the same effects, saying their hospitals have been operating at or near capacity for months. And over the past week, they have seen increases in the number of COVID-19 patients needing care, and that number is expected to remain elevated. Hospitals are seeing more acute non-COVID related health issues in their emergency rooms as well, with many leading to ICU care.
We're seeing people that are coming in with untreated high blood pressure, hypertension, untreated diabetes, and those all lead to more severe disease if they're left untreated.
Hospitals also note patients with COVID in ICU beds tend to be unvaccinated, with Mayo Clinic Health System saying the number of unvaccinated patients is 5 to 6 times higher than vaccinated. In the current Delta surge and impending arrival of the Omicron variant, medical experts are hoping people get vaccinated to lighten the load on these ICUs, along with staying on top of their health in general.
We all need to do, which is what I think we all did a good job of doing prior to this pandemic, and that is see your physician regularly. If you have a new issue, get a hold of your physician or your physician's nurse and talk it through, and don't ignore it and don't delay the care.
In La Crosse, I'm Joe Minnie, News 19.
Similarly, Tacoma Health says it's also experiencing the impact of surging COVID-19 cases, saying in part, quote, "When we have patients who require ICU level of care, we look to tertiary centers throughout the state to take those patients. We've seen an increase in patients that are requiring ICU care and are having a difficult time finding ICU beds, but we are adapting to the situation." Dr. Myrie adds that the public can help by getting vaccinated against COVID and following CDC recommendations for distancing and wearing a mask when in public.